I've just washed my hands with soap and water prior to the video because that is the most effective way to uh, prevent the spread of germs, hand washing. My name is Joyce Myers. I'm an RN, and this is Mr. Myers. We're going to do a brief physical exam today. It shouldn't take more than 20 or 25 minutes. And are you comfortable?
Yes.
Okay. Do you feel like your privacy is at a level you're comfortable with too?
Yes.
And are you having any pain?
No.
Okay. First of all, let's take a look at your arms and hands. I'll just look just one at a time. Okay. Okay. There's good color. There are no lesions, scars, scales, scabs. Nails are pink. Same for this hand. There's a few scattered freckles. Temperature, his skin is very warm and dry. His nails are pink and they're translucent and they're trimmed. He doesn't have any clubbing also going on with that. Capillary refill is less than 3 seconds on both hands. Checking his skull, we have a normocephalic skull. It's very nice, actually. The skin is dry. There are no flakes. There's no the skin around his forehead and onto his hairline is moist. His hair is fine, straight, and dark brown. And I see no evidence of parasites of any type. His face is uniform in color, without lesion. His carotid arteries, we do one at a time. Let's check your carotid artery. Okay, a strong, steady rhythm. On this side, we have a strong, they're equal. There's no bruise. Now we're going to check his lymph nodes. We have the pre-auricular here, just in front of the ear. The posterior auricular, which is behind his ears. Occipital at the base of his skull. The tonsillar. Submandibular. And superficial cervical. Posterior cervical is back here at the base of his neck. And then we have the supraclavicular, which are just above the clavicle here. Mr. Myers does wear glasses, and he's corrected to 20/20. Looking at his conjunctiva, it's pink. I see no exudate or indication of any problem there. This one looks clear as well. If we could get the light dimmed, we're going to check to his pupils are equal and reactive to light and accommodation. If I had an ophthalmoscope, I'd be looking at his pupil, which would be a bright pinkish red. I would be looking at the optic disc, which is a white circle towards the nasal side of the retina. And from this optic disc would be 4 paired vessels coming out, blood vessels coming out. His ears are uniform in color. He does wear hearing aids. There's no problem with the ear, no tenderness. And they're elastic, the temperature is warm, and he has no piercings, and there's no drainage from the ear. Of course, all I'm going to see really is this hearing aid. But we were checking further, and if you didn't have the hearing aids, we'd be checking for buildup of earwax and so forth. There are no foreign objects other than the hearing aid. If I had an otoscope, and if we were to use one, we would be checking for we'd see the tympanic membrane, and we'd see perhaps the incus and the malleus. His lips are pink and moist. His mouth is symmetrical. Can you open your mouth for me, please? He has all of his teeth, and the buccal cavities are pink, and there are no lesions or problems that we can see there. Can you see the tongue a little bit for me? His tongue is pink, and it's a little rough on the top. On the bottom, we have the veins, and it's glossy and moist on the bottom. He doesn't have any oral appliances either. Let's take one more look here, and I'm going to check your tonsils. Stick your tongue out and go, Okay, the uvula is midline, and his tonsils are present at a 2+. All right, now we're going to inspect his thorax and his lungs. Let's check the skin turgor. Skin is moist, or it's warm. It's not really moist. It's just not overly dry. Okay. His AP transverse diameter is 1 to 2. Can you lean forward for me, please, sir? Now sit up straight. Okay. Spine is midline with an S shape. There's no lumps, pain, or fremitus. You're not having any pain, are you? Okay. All right. We're going to listen to his chest for any adventitious breath sounds. I'm going to need you to take deep breaths. Okay. Deep breath in your mouth and then out. Out your mouth. In your mouth. Deep breath. Out your mouth. Deep breath. In. Out. In. In. And out. Moving to the back. Deep breath in. Out. Just take slow, deep breaths for me. Everything sounds clear. Okay. We've checked his lungs anteriorly, posteriorly, and laterally, and he's clear throughout. And I did not give you his vital signs earlier. Well, before we had the video, we took vital signs. His temperature is 98.2, a pulse rate of 78, blood pressure of 127/79. His respirations were at 18, and his pulse ox was 96. I did forget to do that. And also, he's been pleasant and cooperative and in a reasonably good mood, considering I made him my guinea pig today. All right, now we're going to listen to the heart valves. The aortic valve is at the second intercostal space. Listen. The pulmonic is also at the second intercostal space, just a little further to the left. Herb's point is at the third. With the tricuspid at the fourth. And the mitral at the fifth. The best point to get a apical pulse is at the fourth intercostal space. And we're going to get an apical pulse on him now. Okay, I got an apical pulse of 74. It was regular rhythm, and there were no additional heart sounds when we checked the valves earlier. All right, moving on, we're examining, inspecting his abdomen, which is warm, dry, with a moderate amount of hair on it. His umbilicus is inverted. You don't want to press too hard on the belly, or you're going to get belly sounds you weren't expecting. We're going to go to his right lower quadrant, which would be approximately here. And it is positive for bowel sounds. In the right lower quadrant, you also have the cecum and small intestine in that area. The left lower quadrant is also positive for bowel sounds, and he has the descending colon in that area. In the right upper quadrant, just beneath the diaphragm, he has the ascending colon, his liver, the fundus of gallbladder, and a small portion of his stomach is also in this area. In the left upper quadrant, he has transverse colon, spleen, pancreas, and a portion of the stomach as well over here. And we are positive for bowel sounds here. As I said, his skin is warm, dry, extremities look good, everything is smooth. There's capillary refill on the lower extremities is within 3 seconds. He has no varicose veins that I can see. And checking his pulses by that early. Here's radial pulse. They're both equal in regular rhythm and 2+. Brachial pulse. Posterior tibial pulse. These are all regular rate, rhythm, and 2+. And then we'll have the orthopedic. Which is also regular. His feet, there's no edema, no swelling. Did you have any questions?
No.
He is alert, oriented to the person, place, time, and situation. And I think that concludes our brief exam.